trust the federal government. That's why they wrote the Bill of Rights and made the 10th Amendment. The 10th Amendment, where that sign was. You know what the 10th Amendment says? Okay, the 10th Amendment states that the states' powers not delegated to the federal government are reserved to the states or the people. These 13 lines aims to forever change the way we the people run government, because it would take everything away from us. The states would have no more rights. The town of Oyster Bay couldn't fill up potholes. The county couldn't do anything, because everything comes back to the federal government. They will run every facet of our lives. One more question there. Does anyone want the federal government running your life? No! I got it. You know, one day we'll get loud enough, and it's going to shake Washington. But I want to recount what one president would say if he was here today. Ronald Reagan would say, "Let us be sure that those who come after us will say of us that in our time, we did everything that we could do to be done to keep our health care free of government involvement. And the best in the world, we kept the medical decisions between the patient, the doctor, and the patient's family. We kept the faith in that we as citizens of this country can change the course of government, that we can do better than before. All we need to have is faith. All we need to do is act. The time to act is now. Our children, our family, and our parents rest on our actions." Can we defeat this bill? To defeat this bill, we need to do just two things. Two simple things. People on this panel have said it before. November is an election, and elections have consequences. You need to vote, and vote for the people that support us, that are against this bill. The second thing we need to do is come up with an alternative plan. Yes, we just can't say this plan is bad. We need to create plans that we will endorse.
Only free market!
Correct. My solution of healthcare would start with three things. It would be a comprehensive reform. It must be consumer-driven, i.e. it must be driven by us. We must pick and choose. And the private market competition must be in it, and it must be driven by personal responsibility. Comprehensive reform will give us the end-to-talk reform that the doctor was speaking of. Thereby, big companies don't go into certain fields because they're afraid of the lawsuits and the litigation, thereby reducing compensation and the ingenuity that would change things. The new reforms must include consumer-driven. This is where individuals themselves are making a decision on the type of care that they need and want. This way, we control what we're paying for. The only way prices for health care are going to come down is competition. We all remember how the federal government paid $300 for a hammer and $500 for a toilet seat. Do you think they know anything about competition? In my concept, each state must have a basic coverage. It would be a catastrophic policy. That's what we all must have. Of course, it has options. Mandatory options that every state pays. But that's optional for me, you, and I. I don't think I'm ever going to get pregnant, so I don't think I need to buy pregnancy coverage. It also has to give other options that the company that differentiates themselves. But in the end, the only people who should make a decision on this is not the government, but you and I. If we decide to do this, to put together a catastrophic policy, the thing that's going to come out is that we're all going to be covered. We're going to be covered by something we want. Now, if you all decide, some people say that health care is a right. A right comes with responsibilities. And if you think health care is a right, then you have a responsibility to pay for your health care. No more free ride, period. If we introduce self-responsibility into the issue of health care and the American way of life, ladies and gentlemen, victory, total full victory is ours. Let's work together. Thank you for coming tonight. Let's get it done.